I certainly am. So today I'm here to talk about ISO 45003, but basically with a view of putting people first, why it's so important to put people at the heart of everything we're doing to manage psychological health, safety and wellbeing at work, but also for the success of your organisation. So if we can go on to the next slide, please. So people really are at the heart of organisational success. Nothing an organisation does is going to work unless we bring our people with us. Psychological health and well-being, it's fundamental. It's not a fluffy subject. It is absolutely at the heart of productivity, managing change, staff retention, engagement, and ultimately the long-term success of your organisation. Next slide, please. I think you'll all agree that we're living through challenging times. It's a period of massive change, lots of volatility, lots of uncertainty, lots of upheaval. We are perhaps, possibly, hopefully coming out of the COVID-19 pandemic, but we have other things going on. This week it's monkeypox. But we also have political and economic instability. We have individual job insecurity. There is social unrest. There's division in the country and across the world, widespread inequity, and of course, the climate crisis, which is influencing everything. And all of this has an impact on our psychological health, safety, and well-being. It doesn't matter that this is outside of the workplace, it impacts our workplace. And we as human beings are not somebody different outside of work and inside of work. So if we are anxious about something or going through some issues, they're going to come to work with us. And then if there's issues at work, we take them home with us. So this isn't something that organisations can afford to ignore. It's not something that's dealt with by yoga classes and free fruit or cupcakes or all those nice things. It goes much more deeply than that. Next slide, please. So even before COVID-19, stress, burnout, anxiety and depression cost our economies billions. It is by far the greatest cost in terms of occupational health and safety to organisations. So 55% of working days lost in the UK before the pandemic were due to stress, depression or anxiety, and it has only got worse. It was already on a big upward spiral, and this has accelerated it. So you can see the stats there. I don't need to talk about it. But I think it's really worth thinking about the fact that until very recently, and this might be something good that's come out of the pandemic, many organisations just weren't taking this seriously or perhaps didn't have a proper understanding of it. That bottom right-hand side box, in 2016, 745,000 people died from overwork. That's huge. That's huge. It should be headlines everywhere. We should be able to go to work and come home at least as well as when we turned up. It shouldn't be making it worse, but it is. So let's go on to the next slide, please. Psychological health absolutely depends on organisational action. Organisations need to understand how psychosocial risks arise from the workplace, how work is organised, social factors, and the work environment itself. And what's absolutely critical, if we're going to get on top of this, if we're going to mitigate all the problems that we're having, is a commitment to ongoing action to eliminate or manage those risks that are in the organisation's control. As I say, we can't tackle climate crisis and anxiety around climate crisis in our organisations, but we can do what we can do that's work related. And involving everyone in building that safer, healthier, happier work environment is absolutely critical. It's not something that can just be landed on people, even though leadership is critical. The whole workforce has to be involved in this. And ISO 45003 will help with that. And I put it in red because there's often too much emphasis on this in organisations who are beginning to tackle with well-being. Personal resilience programs are not the answer. You can only expect people to be so resilient before they break. But really, people shouldn't need to be resilient at all. They just shouldn't need to be. The workplace should be a safe space. You should be able to get on with your job without having to soak up lots of stress. For example, there's lots of other issues, but stress is a big one. So those aren't the answer. So let's talk about the standard itself. Next slide, thank you. So ISO 45003 is the first global standard on managing psychological health and promoting well-being at work. And it's a practical document. It's full of examples and recommendations. And as I was emphasising before, it focuses on organisational change rather than individual intervention. If we need individual intervention, we've probably failed somewhere along the way. That's the absolute last resort. It's written to be accessible to everyone, including those without any current knowledge or any expertise. We know that most organisations don't have psychologists on the staff. And you don't need to be a psychologist to benefit from this standard. Even if you were perhaps, let's say you're the owner of a family restaurant. You run it with 2 or 3 members of your family, you've got a staff of 5 or 6 part-time employees, you can benefit from this standard. So it's suitable for all types of organisations, big or small, whatever they're doing, wherever they are based. We can go on, please. So one of the first places that we need to look as organisations is at how work is organised. This is far and away one of the biggest areas of risk. And, you know, everybody on this call, I'm sure, will to a degree recognise some of this. If we are not clear about what we're being asked to do in our job, it's stressful. It makes people anxious. If you're given constantly conflicting demands, like one boss is saying do this and another boss is saying doing something else, and they're not compatible, what are you supposed to do? You can't fix that yourself. So this lack of control is a big issue. Empowering workers to have more control, empowering workers through collaboration before decisions are made, rather than having decisions made for you without the full facts. These are things that are fixable. If you involve the people, listen to the people who are doing the work, the leadership is going to understand much better what the real problems are, rather than assuming what the problems are. And then we've got things like shift work. We know that shift work causes health problems, something that needs to be looked at. Can we make it better for people? Listen to the people doing that work and see what's happening with them, what they find problematic. Long, unsociable hours. They're hard to manage when you're thinking about this is a whole person. They also have a life. How's it affecting their life? We know that it's not just psychological health it affects, it's also physical health. This is where those heart attacks, the strokes, the real life-changing major health issues come from. It's from these overlong hours, this shift work, where people don't get proper rest, for example, where there's no flexibility in management on how this work is done, when this work is done. That really impacts on health, as does working far from home, or working from home all the time without enough peer interaction. That can be a problem for some people. So we've got to get this balance right. And again, it's about listening to people. And the whole job security thing, in the last couple of years, job security has been a real issue, more than it usually is. It's always there. But insecurity, people have lost work. Businesses have closed down overnight. People have been put on furlough, don't know if they're going to have a job to go back to when the pandemic's over. All of these things are big and they can be managed. Sometimes it's inevitable. Sometimes it is going to happen. But this is where communication comes in. We can go to the next slide, please. So, fourth bullet point down, what I was just talking about. Communicate clearly, regularly, and most of all, honestly. Even bad news is better delivered earlier. That will lead to better health outcomes. And if there is an opportunity to really discuss, allow workers to know why a bad thing is happening or a good thing. Really inform people, bring them with you, because you've got to bring people with you in your organisation. And if you're looking at making changes to how work is organised and all those things that were on the previous slide, involve the workers. If you involve the workers in identifying solutions and work with them to decide which solutions are going to be implemented, if you get their agreement, it's going to work much better. You'll bring people with you because the workers will own the solutions. It won't be being done to them. So make that participation meaningful. Don't do consultation for the sake of it after you've actually decided what you're going to do. That's so damaging. It does such damage to your workforce, and you will lose engagement and you will find people more stressed. You will find that people start to resign, look for better organisations to work for. So be flexible about how the work is done, where the work is done, when the work is done, and how you're going to manage these particular needs. If we can go on, please. So we talk a lot about psychosocial risk in ISO 45003, and it's a word that many people go, well, I don't know what that means. That's an expert term. And it is, but it's also quite straightforward. Psychological risks caused by social interventions. We're social creatures. People are social. And those social interventions, those relationships can be good and they can be bad. They can be nurturing or they can be damaging. So one of the key things that organisations need to look at is that interpersonal conflict. There needs to be a genuine zero tolerance of harassment, bullying, victimisation, discrimination. There should be no room for them in a modern organisation. Unequal power relationships really, really make a difference. If you have a manager who is power hungry and likes to put people down, you're going to have an unhappy workforce who are not productive. And they're not going to be engaged, and you'll lose their loyalty to the organisation. Abuse of power is huge. If things feel unfair, it's going to cause problems. You don't want people being anxious because leadership is making some poor decisions or not informing people about decisions, and then it suddenly impacts them. Work-life balance, perhaps harder now than ever, particularly when so many people are working remotely. Lots of blurring boundaries between home and work. This needs to be discussed. We need time off. We need time with our families and our friends, and we need to be able to have enough rest. So the always on culture is something that needs to be addressed, and people involved in standards, particularly over the last 2 years, will know how many unsociable hours have been needed to develop standards, to go into working groups where you might be working at midnight or you might be starting at 4 a.m. And if you're not, somebody else is, because time zones. So these are things that the organisation you work for needs to take into account. If you're being required to work at unsociable hours, you shouldn't also be being required to be available 9 till 5 in your normal day. There's got to be a balance there, or people will get ill. There will be burnout. And that's a really big issue right at the moment, likely to be for the next 10 years or so. The impact of COVID, and bear in mind there was a problem before COVID, but the impact of COVID is going to have a very long tail. Things are not just going to get better. And I think that is something that we're underestimating at the moment. People are rushing back to normal, but things aren't normal, and people haven't actually processed and healed from the trauma of the last few years. If we can go on, please. So culture. Culture is at the heart of everything. Our cultures need to be safe and they need to be inclusive. We need to feel that it's okay to tell our manager, I'm having a bad day, I can't cope today, I need a rest. We need to be able to say, I'm suffering from depression, and there to be no stigma, but also for an organisation and for all the managers in the organisation and your peers to take it as seriously as they would if you said, sorry, I've got COVID, I can't work. It's just as important. And actually, psychological ill health is likely to lead to longer sickness absence than physical health. Overall, that's what happens. So having a culture where we can talk about it early, we don't leave it to the last minute, we don't pretend we're okay, we don't just keep coping, when actually what we should be doing is taking time off and saying, I'm ill, I need to rest. That's a big change, and it really needs to happen. But we all have a role to play in that. We need to be the change. Whatever position we're in, whether we've just started in an organisation and we're the lowest grade, or with a CEO and we set the policy, we have to talk about our own psychological health and well-being. We have to recognise what's going on with other people. Spot when your colleagues' behaviours change. There's probably something wrong. And they might smile and say, yes, I'm fine, when you ask. But it's so important just have those conversations and to listen to each other. Have a conversation with your manager, have a conversation with your teammate, have a conversation with somebody you are passing by if you're in the workplace and you see them. Say, would you like a coffee? Connect. The connection will really make a difference. So empower yourself. Go and read the standard. Everybody can read it for free on the ISO page under the COVID-19 documents. And of course, it's available from the BSI shop to buy. But everybody should empower themselves, because the guidance in this document is there for every worker, as well as the people who are managing health and safety or in the HR department or setting policy. If we can go on, please. So the work environment itself also has an impact on psychological health, safety and well-being. If you haven't got the right kind of equipment or enough equipment, or even if your chair isn't right that you're working on, it's going to impact your psychological health and well-being. This is really important to be taken seriously. It's not just physical, though, as I say, they are all interlinked. And lack of space, poor light and excessive noise, temperature extremes, all of those things also affect our anxiety, our ability to relax and just do our job. Unstable environments. Some people work in conflict zones. Some people, let's think police, security guards, staff in the accident and emergency room at your local hospital. These environments are very unstable. There can be trauma day after day after day. So we have to take that into account. We still have a duty of care to people whose work inherently is stressful and can damage psychological health. If we can go on, please. So, if possible, give workers options about where they work, when they work, all the things I said before, and listen to individual needs. Recognise the need for breaks, time off, changes in environment. When that individual asks for it, It won't be the same for everybody. And implement support systems for workers in unstable, potentially traumatic environments. There needs to be processes and mechanisms that the workers understand they can utilise if they're working in a difficult situation, if they've had a customer yelling at them, threatening them, if they've been abused on the street because they're a police officer, or attacked by somebody drunk when they're trying to give them healthcare in a hospital environment, for example. There needs to be a sort of support system there so that those workers know that they can take a step back, recover, talk to somebody before entering back into that workplace. Again, don't expect endless resilience. People do break. Ultimately, they will break. Next slide, please. So we are beginning to see a degree of return to normality, but it's going to be new. It's not going to be the same, however much anybody might like it. Needs and expectations have changed across the board. Many workers will not put up with what they used to put up with, and they are voting with their feet. I expect most of you have heard of the Great Resignation, where people have just reevaluated their lives. If organisations want to keep their employees and they want to be successful, they need to work with them to see what works. As I mentioned, not everybody's going to bounce back from this period. And to be fair, there's all sorts of other problems now. It wasn't just the pandemic. We've got a war in the Ukraine. We have all sorts of policies coming through from government which may impact certain individuals and not impact others. So we've got to think about the individual needs, the fact that different people do different things and experience life in a different way. The new normal needs to be planned and managed with input from everybody. Who you are makes a difference. How you walk through the world makes a difference. If you're male or female or non-binary, it makes a difference. The race you are, your religion, your cultural beliefs, they all impact how you're treated at work. If you're not one of the majority, you may have a different way of feeling things or experiencing things, or you might be isolated. You might feel isolated, even if your workers don't think you're isolated. So we've got to have these conversations. So aim to retain the positives that we've got. Some people really like being able to work from home. It suits them. Introverts often prefer to work in their own environment and only come into a workplace when necessary. If your role allows that, if the type of work you do, allow people to do that if it's not impacting their productivity, because you're likely to have more engaged and happier staff. Equally, some people hate it. They want to be in the workplace with colleagues and directly collaborating. Encourage that if it works for them and it's still working for your work. It's all about conversations going forward, but please go and read the standard, empower yourself, talk to your colleagues about it, and most of all, take action now. This isn't something to put off. You're not going to get it perfect. Do something that's good enough to make a difference. Make a difference with one person, make a difference with everybody, but don't put it off. Next slide, please. Thanks. So do get in touch if you've got any questions about ISO 45003. I'm more than happy to talk to you about it. And there is also training, assurance, and actually certification, because the market has asked for it. And my colleague Kate, who's on the assurance side of BSI, is very happy to help you with that. And now if anybody's got any questions, very happy to take them.
Feel free to come off mute and ask questions as well as popping them in the Q&A box.
I see that Linda is asking what the take-up is so far. I have to say, Linda, I don't know numbers, but it's been huge. We get requested to talk about this standard, to introduce this standard to countries all over the world. I speak on ISO 45003 at least once a week, I would say, and I have done since before it was published. And I know that Kate, our global OH&S champion, also does the same thing. And we get asked for a lot of guidance and articles. People can definitely have the slides after this is over. If you're interested, that's absolutely fine. No questions. I've never done a 45003 talk before, and there's been no questions. Tracy, thank you for saying that. Lots of factors that resonate for the radiographers you work with. It's really interesting that you're absolutely right. This standard is articulating, I think, a lot of things we talk about amongst ourselves, amongst our peers, but they aren't always picked up by leadership. And this is where our work really starts. We have to, some of us, manage up. We need to push the fact that this is really important. And the HSE, the UK regulators, are doing just that at the moment. The law is changing. And in fact, we are going to have a webinar quite soon. I can't remember off the top of my head when it is, but about the law and mental health and how 45003 works with that. Because there is far more liability on the organisation now to properly manage this. Okay, well, if there's nothing else, let's call it a day. But I am around if you want to get in touch. If you think of something afterwards or want to ask something privately, you're very welcome to.
Thank you so much, Sally.
No problem at all.
Thank you.
Thank you. I enjoyed that.
Thank you, David.